we all know that right now, research is the paramount of medicine. It's become the epitome of medicine in a sense that if you want to specialize, you have to do your MMed. It's non-negotiable. It's something that you need to familiarize yourself with, whether or not you're already in the REG post or you're planning to get into the REG program. You need to know a little bit something, and there's a lot that we don't know. There's a lot that we don't know because research is quite a huge topic, which I don't think we'll be able to dissect everything in one day. But we aim and we plan to have a series of talk, like a series of talk where we take away the anxieties that most of us have around research because of fear of lack of knowledge. But nonetheless, today we have a very special guest with us. Amongst us this evening, we have Ms. Nancy Hornsby. So a bit of introduction from my side. So she's a senior scientist in the alcohol, tobacco, and other drugs research unit at the South African Medical Research Council in Cape Town. She is completing a PhD degree, which is actually focusing on neurophysiology of adolescents who are heavy drinkers through the Department of Psychiatry at the Stellenbosch University. So her research interest is in neuroscience and also public health.
Anyway, yes, thank you for having me tonight. I'm aware that, I can't even imagine what your schedules look like. So I'm very happy that you are joining in and that you are obviously showing a keen interest in the research. As Doc is saying, the research aspect is becoming more and more of a required component. So with that, I will share my screen. All right, right. So the title of the session today is around research. What are the steps that what needs to be done in the research process, what are the core or the fundamentals of the process, and as Doc has indicated, it is a daunting endeavor, but it's not it is doable, with the right team. So I'm not going to go through who I am because Doc has already done that. I'll just do a brief overview of the content. And I really agonized over what I was going to cover because it takes years of training and a lot of theory before you get to the practical part of actually doing the research. And I really had to agonize over how I was going to fit all of that into an hour-long session or so. But anyway, I'll try my best. There's a lot of things that are important that I won't be able to talk about now that I already skim over, but we can definitely talk about, maybe doing a series of sessions. So we'll first talk about why research is important. We'll discuss research paradigms, how to go about conducting good, scientifically robust research. So this really is looking at the components of a research plan, which is essentially the proposal. I've worked in a little practical session because I'm trying not to make this too didactic. I suppose I really can't get away from that, but I also want to make it more interactive. So I welcome questions throughout the presentation, so please do feel free to interrupt me at any point. And then I'll just do a brief look at the purpose of the HREX and navigating that process, because if you're not familiar with it, it's also, you feel a bit lost. And then we have like a QA or discussion session where I'll just open it for the floor. Right, so where do I start? And this is how, whether you've been exposed to research or not, this is how many of us feel. Even with experience, sometimes it's when you want exposure to different topical fields or different areas, it takes getting used to. So it's quite a thing to navigate. And at the beginning, it really feels like one wants to give up, but as I said earlier, it can be done. So I'm going to at least attempt to demystify the research process, because as you know, as I said, many different elements. But you know, once you have a good grasp of you know what goes on in research, you know, it's never easy, but it becomes easier. And I'll talk about the research team and why it's important to have a good team, you know, in this process. So why is research important? Essentially, it's a fundamental, essential part of advancing human society in different ways. So be that health, engineering, nanotechnology, agriculture. And research emerges from our innate desire as the human species to improve our lives and understand the world around us. That is just how we have been programmed. That is why we send people out into space. We try and push the boundaries all the time. And we also do research to improve our insights. So we, as humans, we have to know how things work, and we want to find out different ways to make things work differently. Also to find out ways to make things that don't work, to make that more effectively and make that more efficient. Can I just say, I am working, I'm doing this from home. I have 4 dogs, so please bear with me if there's noise. For some reason, my headset doesn't want to connect. Right. So, having said that, it's not just about doing research. It's also about doing good, scientifically robust research. And we will get to what scientifically robust or rigid research is later on in the session, and what I mean by that. So what's the research paradigm? That really is the beliefs and the assumptions that underlie and provide structure to your research. And these are usually characterized by one's discipline or even one's personal beliefs. And it's the framework within which the theories and practices of a discipline fit to create one's research plan. And then it forms the foundation that guides all areas of the research plan. So it's the study aim, the research question, instruments, measures, analysis, and methods. And just to take it a step back, I am covering more of the, not more, I'm trying to be practical, but I have to start off with a theory, because that's the basis of everything that the practical steps are built on. So if you feel that you are zoning out, yeah, this is just a part that that can't be brushed over. Right, so research or paradigm models in research. The one approach is positivism. That is the using quantitative methods. It's deductive, uses logic, and it's typically confirmatory research. Then there's interpretivism. These are qualitative methods. It takes the constructivist approach, and it includes exploratory research. All of these terms that I'm throwing around, this I won't go into now, but there's actual, if we do have sessions on this, there's actual sessions that really unpacks what each of these, what goes into it and why you would use one or the other, but that's just beyond the scope of today's session. So just to give an example, to kind of concretize what I mean by paradigm models, to give you examples of different paradigms, if your discipline is molecular biology, for example, and you are conducting research to establish the molecular structure of the DNA molecule in a specific disease, your study is probably based on the premise that there is one reality, and your study results will either show a specific molecular structure or not, and how the structure relates to that disease. So that's more of the positivist, deductive, logical paradigm, where there is one reality for what you see. On the flip side, if you, for example, a sociologist, some, in the social sciences, and you want to investigate the effects of parental education on childhood literacy, you would examine the research topic from a very different angle. So you'll use different viewpoints, such as micro and macro level cultural and social influences, socioeconomic influences. So from a sociological viewpoint, you would say that there is not one single reality, but different realities acting out on what you are investigating. And so we see that research findings will depend on one's assumptions, beliefs, and also the biases that underpin the research in question. And this term, biases, because there is bias in any research, but again, topic for a different discussion. And so the research paradigm is a broad area that deals with a philosophical framework, frameworks that underpin research, which I really cannot cover in this session. There's also variations of these paradigms, right? So people are increasingly, or not increasingly, they've been using it for many years, but many studies use the mixed method design, where they use both quantitative and qualitative approaches. And I'll talk about this a little bit later. So what it goes into conducting good research? The research process comprises a series of systematic procedures that a researcher must go through to generate knowledge that is valuable and focuses on the relevant topic. The research must conduct research that is effective and scientifically robust. So increasingly committees, ethics committees, and so on, or funders are asking what, yes, scientifically robust, but what is the application? What's the real life application, the meaningfulness of your research? So that's very important, that one has to demonstrate that. The pie in the sky, ivory tower type of research, no longer flies in the world of research. Conducting research is complex and complicated, but there are clear processes and steps to follow to ensure that the process is underpinned by good science. And this is something I'll come back to, because it really underlies everything, is good science, conducting good science, because it's like nonsense in, nonsense out. You get out what you put in. So if you put in bad science, you're going to get bad findings. So the process starts with a broad concept or an idea or a topic, after which the steps in the research process must be followed. And this really gives an overview, and I'll unpack each of these. And it's not as linear, but these are all the steps that need to be followed. But you would typically move between steps as well, especially in the not between steps, but in the planning phase. So there's a very clear planning phase before you move on to the next step. So first, it's to identify the problem. You would evaluate the literature, you create or craft hypotheses, you develop the research design, describe the population. There's obviously the data collection phase. Without data collection, you don't have findings. The analysis part and report writing. So that's for the research process. But because I was kind of struggling with what I'm going to focus on. So it's a mixture of this process, but it speaks to the actual protocol. So what a research proposal will look like. Because the research proposal, all the sections in the proposal actually follows these steps and must include each of these components. And you'll see how that is done. Right, so step one is identifying the problem. So first you write down the problem statement just broadly, and from that problem statement, you formulate the research question. And we'll go into how a research question is done or written well. So it's important that that question is well defined, because this will guide the researcher through all the stages of the process. So that is setting aims, setting the objectives, choosing methodological approach, and also what the appropriate analytical plan is to answer the research question. So firstly, the question mustn't be too broad and it mustn't be too narrow either. So it must have appropriate scope. If it's too broad, it won't be possible to answer the question because it'll just be too much, or it won't be focused enough. If it's too narrow, on the other hand, you won't have enough to write about, or enough to actually investigate, and you'll struggle to develop a strong argument. The second point is that the question must be relevant and concise. So the main ideas must be expressed in as few words as possible. So it can't go on and on. I've seen, some very poorly written questions before, where the reader just gets lost. You don't even know what the topic is under investigation. Thirdly, it must be precise, but at the same time complex. So it mustn't, the answer to the research question mustn't be a simple yes or no. So it must require an analysis of arguments and an analysis of the literature. The fourth part of a good research question is that it must be researchable. So with that, I mean the availability of and the suitability of quality research is important. So that includes academic books, reference journal articles, and so on. So relying on sources that are not credible, that hasn't gone through rigorous peer review, or articles from predatory journals with little to no peer review, that will then put a big question mark on the evidence you are using to base your argument on. So the reviewers as well, they are anyone reviewing the proposal, that is what they look out for. So I've marked a few proposals. Look at and examiners as well, they will look at the type of references you are relying on. So using books, newspaper articles are fine, but it should be mostly on peer-reviewed reference journal articles. It's usually where the books come in is where it refers to theory or some sort of framework, theoretical framework. But otherwise, if you talk about scientifically robust evidence, it would come from journal articles and quality journals. Impact factor is also an important factor. So the higher the impact factor, the more credible the journal. That is debatable because there are scientists who are arguing against that, but that is still the status quo. The fifth point is that the research question must be arguable and testable. So it should allow the researcher to produce an analysis of the problem rather than just a simple description. And lastly, it must be clear and focused. It also speaks to the conciseness. So readers must be able to easily understand the purpose of the research, reading just from reading the question. So let's look at how we go about formulating a good research question. And this PICO, I'm sure many of you have come across this. This was first introduced by the scientists in the Cochrane world that looks at, they focus on reviewing or systematic reviews of clinical trials. So PICO stands for patient population, intervention, exposure, comparison, and outcomes. So it's important that a good research question has all of these components. So when we ask patient or population, there we ask who is the patient. There it's how do we describe the patient population? What's the age, sex, race of the patient? What's the primary problem or the health status? Under the intervention component, there we ask, what do you plan on doing for the patient? So is it going to be a diagnostic test? Is it a medication? Is it some sort of therapy, treatment, or procedure? Comparison, what are the alternatives that you are considering? Is it another test, medication, or procedure? It's just important to note that not all studies have a comparison. It could also be an exposure. So exposure to a certain disease or condition, or exposure to antigens, for example. So it's not always an intervention. And then last, outcomes. So that is, what do you wish to accomplish? You know, what do you want to change? Is it accurate diagnosis? Is it relief or improvement in symptoms? Is it to maintain function? So the research question must include the population of interest, the main variables under investigation, and the relationship between the variables. And it will become clearer as we go along. So let's yes. Oh, I thought I had someone asking a question. Sorry. Okay, so we'll look at some examples of research questions. The first example, and then we'll apply the PICO to see whether this question has all of those components. First question is the ACE inhibitor medication enalapril, I hope I'm pronouncing that correctly, effective in the treatment of hypertension in pregnant women aged 18 to 45 years. So when we apply PICO, the patient or the population would be pregnant woman aged 18 to 45 years and with mild chronic hypertension. The intervention in this case is the enalapril medication, ACE inhibitor medication. Comparison, so there's no comparison because they're not comparing it to any alternative treatment, and the outcome is improvement in hypertension. Second example, does intravenous dexamethasone reduce 28-day mortality in adult hospitalized patients with COVID-19 compared to standard care? So if I can throw it out, I mean, I'm not expecting anyone to get it right at this point, but what would you say would fall under patient population? I don't think I'll be able, if there are chats, I don't think there are, if people are going to write it in chats, I won't be able to see that.
Can I try answer?
Yes, please go for it.
Okay, so I think patient is adult hospitalized patients with COVID-19. And then I think the intervention is the intravenous dexamethasone. And then the comparison is standard care. And the outcome is a reduction in 28-day mortality.
Let's see how you did. Gold star. 10 out of 10. Yes. Yay. So I'm not even going to go. Yes. Perfect. Yes. So you see these questions have all of those components. They clearly speak to the different, the population of interest, what we are looking at, what's the outcome of interest. So that would be examples of formulating a good research question. So I've used this type of examples, but it can be, it might not be a, like I said, an intervention. It could be an exposure to a certain or certain disease or exposure to something. We're not testing an intervention specifically, but maybe, sorry. But looking at differences between, for example, a group that are known as the cases that has a certain disease compared to healthy controls. So I didn't want to use too many examples because there's quite a bit to cover. So there's various ways that one can start off with just there's the formulating part, but just identifying an area for investigation. So typically researchers would conduct preliminary surveys, they would do case studies, they would conduct interviews with small groups of people, like focus groups, or interviews with individual interviews, conduct observational surveys. So it's important to start with these small studies that aren't cost or resource intensive before one proceeds to the large scale studies that require more financial and human resources. Because imagine jumping into a large study of 2,000 participants, to test some sort of drug. There's a lot of money, funds that's invested, human resources, staff, infrastructure, equipment, to find out that the study has, someone else has done it already, or other researchers found that there is no relationship between the intervention of interest and the population, and so it's always a good starting off point, these smaller studies, qualitative studies. So we refer in research to the golden thread. So we spoke about the research question and formulating a good research question. And these three components are what underlies the research process. So the research question, the aims, objectives, hypotheses, each of these speak to itself. And together, they are always bundled together and referred to as the golden thread that draws together the entire research project. So these elements that define the focus and the scope of any research project, whether it's a primary research or it's a dissertation, thesis, or research paper. And as I said, they are always bundled together, and it's important that they are aligned with each other and with the entire research project, that the entire research project aligns with these elements. And this thread runs throughout the entire project from start to finish. And it's really so important. I can't stress it enough that the research must always come back to this golden thread: the question, aims, objectives, hypotheses, at every point in the research process. So whether it's writing the literature review, doing the actual data collection, everything is to come back to that and ask, am I answering what I'm supposed to be answering? Failing to do so could lead to collecting, irrelevant data, where it's for example, data that's not even related to the research question or what you are investigating, or including unsuitable study participants, or using the wrong analytical approach. And if these elements don't align, the research will then pull in different directions and it will lack focus. So as I said, the literature review, the research design methodology, all of these components of a good proposal will be influenced by this thread. And we'll talk about and unpack the research components in a little bit. So it's important to take time to carefully craft the research question, the aims, objectives, and hypotheses before running off on a research path, right? So even if it takes a while to get that pinned down, but that is time and effort well invested. And it's also important to get an experienced researcher or a supervisor to review and comment on this golden thread before investing any significant time into the project or even starting the process. So, I mean, many, I'm talking from experience where I've worked with researchers who just want to jump into it, but you need to do the homework first and lay the groundwork. So then now we are looking at the different components of this golden thread. So we dealt with the question, research question. Now it's the research aim. So the aim flows from the research question, and you can have more than one aim. But the research aim is a statement that reflects the broad overarching goal or goals of the research project. and they outline the general direction of the research and what the research is trying to achieve. And the aim usually provides a high-level description of what the study is about and what it seeks to achieve. And they're not at the aim level, or when we are formulating the aim, they aren't at that level. It's not yet specific or action-oriented. So it's more low resolution. So instead, they clearly set out what the study focus is and what is under investigation. So the study aim usually starts off with this research aims to, or this study seeks to. So examples are the study aims to establish whether a link exists between high BMI and depression among first-year university students. Another example, this research seeks to identify neuromorphological disruptions as a result of binge drinking among adolescent offenders. The second one, you can see I borrowed quite heavily from my content area. So it's about the primary aim, the goal that you are setting out, and this helps. This should, as I said, speak directly to the research question. You must be able to answer the research question. So you must ask yourself, does this answer the research question? The third part of this is the research objective. Most likely you'll have more than one objective. So objectives take the research aim down to the practical, actionable level, and they showcase the steps that the researcher will take to achieve the research aims. Unlike the aims, the objectives are much more specific. So there's higher resolution, more granular than the aims, and it's more actionable than the aims. So the objectives must be specific, they must be measurable, achievable, relevant, and time bound. So it can't be that, it's you're going to investigate something, for the next 20 years. It must be time bound. And the objectives serve as action points that give the research a clear, almost like to-do list. And some examples here is to assess whether BMI levels higher or equal to the 25 are associated with high depression scores among first-year university students. So there you can see it talks about the directionality. So what's the relationship we are anticipating? In this case, for example, higher BMI levels, there's a positive relationship. When I say positive, I don't mean it's a good relationship. It means as one thing increases, as one variable increases, the other one increases as well. That's also another topic of discussion. But so positive relationships, so as BMI levels increase, depression scores increase. So that's the positivity in the relationship and the directionality. The second example is to measure if binge drinking is related to reduced hippocampal volumes in adolescent offenders. So there we would talk about, when we talk about relationship and directionality, that's an inverse or negative relationship. So as binge drinking increases, or we would hypothesize as binge drinking increases, we would find reduced hippocampal volumes in adolescent offenders. I hope it's making sense, and please, tell me when I must stop and just go back or clarify something. Right, so then hypotheses. So not all studies will have hypotheses. So if it's qualitative approach, you won't have hypotheses. And hypotheses, it's usually when statistical analysis involved, that then hypotheses must be stated, and more likely you will have a number of hypotheses, because these are the very, very granular, so even more granular than the objective. So hypotheses are statements that can be tested by scientific research. So we write hypotheses to test relationships between two or more variables before starting the experimental data collection. And the examples I'm using are just between two variables for now, but you can have, it's usually, like one outcome variable, but there can be more than one outcome variable. But in research, it's always recommended to have one main outcome variable of interest, but you can have many factors or and you'll see later on what I mean by independent variables. And I'm sure you've already been, you're familiar with these terms, but you can have more than one independent variable exerting an influence on the dependent variable. So more likely you will have more than one, you will test relationships between more than one variable. So you'll have a number of hypotheses, because each hypothesis will speak to testing relationship between one dependent variable and one outcome variable, if that makes sense. But we'll see, when we look at actual examples. So it states the predictions about what you expect to find in your research. I've said this just now, you might have one or more hypotheses, and they propose a relationship between two types of variables. An independent variable, so that is the variable that the researcher controls or changes, so that exerts influence on the dependent variable. And then, which leads me to the dependent variable, that is the variable the researcher observes or changes. So the independent variable will exert or influence the dependent variable, which is also referred to as the outcome variable. So the dependent variable also referred to as outcome variables. Independent variables are also, we refer to these as factors or explanatory variables. So they explain what we see in the outcome, dependent variable. So you then have to refine the hypothesis by making sure that it contains the relevant variables, the specific group being studied, and the predicted outcome of the experiment or the analysis. And as I said earlier, if the research involves statistical hypothesis testing, then the null hypothesis must also be written down. So the null is the default position that states that there is no relationship between the variables, or that there's no difference between one group and the other. So they are usually they're written with these subscripts. The null is usually H with a subscript 0, which means no difference. And this is followed by alternative hypothesis, which is written as either H1 or HA. And you will have this for each objective, for each independent variable and outcome, for each relationship between variables. So the first one here is where the null states binge drinking is not associated with reduced hippocampal volume in adolescent offenders compared to healthy controls. The alternative would state binge drinking leads to reduced hippocampal volume in adolescent offenders compared to healthy controls. So in science, empirical science, we always start off with the premise that no difference exists, hence the null hypothesis. And we kind of set it up. We set up the research project in such a way that it doesn't bias the findings towards, seeing what you want to see. You have to set it up in such a way that the findings aren't because, of some sort of sampling error or inherent bias in how the study was designed. And all of these are statistical concepts that cannot be covered. It's simply too much to cover in this session. But just to note, that is the hallmark of good science, is that it's set up so rigidly that when you do find a difference, it's not because of some fluke or because you've set it up in such a way that you will find, you will find a difference. You will find what you are hypothesizing. So that is then how this golden thread flows through this. Yeah, and this is the really the lays the groundwork for everything that follows, because everything that follows must speak to hypothesis, objectives, aims, and the research question. Right, so, and we'll do a practical session on this later on. The literature review. So this is when, so now you've done all of that, you've established your research question, you've done all the prep work. Now your supervisor said it's A4 away. Now you're ready to start with the protocol or the proposal. And how the proposal looks, these are the core components of any proposal, whether it's for a dissertation or just for a research paper or just for primary research. This is what should be included in any research protocol. But you also write protocols for different purposes, like for grants, and that again is also a different topic. But these are the standard components. So you start off with a literature. So it's usually there's the introduction, which introduces the reader to the problem, right? The problem statement. So that's where the all of the groundwork, the hypothesis, and so on, that goes into the introduction. I actually should have had a slide on this, but that is the very first part of a research proposal. Then you go into the literature review. The literature review is a summary of a subject field, or provides an overview of the scholarly sources that supports the identification of a specific research problem or research question. However, in addition to summarizing, a good literature review also provides a rationale, so a justification or an argument for what you are trying to do. And it also analyzes, synthesizes, and critically evaluates the evidence. So it must draw on and evaluate a range of different types of sources, such as credible academic and peer-reviewed journal articles and web-based sources. And I've spoken about this in the earlier slides. In the literature review, you must use relevant sources. So it must speak to the population and the research area of interest. It must use up-to-date sources. So it can't be sources from using studies from 1989, for example, unless you are making reference to some seminal work or theory. But otherwise, you have to use up-to-date research. I mean, at this point, using sources from the 1990s would be outdated, for example. And in your literature review, you must provide both sides of the argument. So by that, I mean, provide evidence that are both in support of the argument you're trying to make, as well as antithetical evidence to the area of investigation and the theory that you're using in the research. So for example, if we are saying that the Pinot principle around neuroplasticity, for example, that neuroplasticity makes all young children the brains of young children are more vulnerable to trauma or to insult. You would also have to give the opposing view that says, for example, there's actually more protection because the young brain is more plastic, and not protection, it's more plastic, and so there's greater opportunity for resolution of functions, for example. So both sides of the argument. So in the literature review, you must demonstrate a sound understanding of the topic and its scholarly context. You must develop a theoretical framework and methodology for your research. You must position your work in relation to other theorists or researchers. You must frame the problem statement and show how your research addresses the research gap, or how it contributes to current knowledge or debate. So it's typically around there being a dearth in research for a certain population, or there not being, there's a gap in research for, certain cultural settings, but it must make a valuable, what it essentially asks, what is the scientific contribution, of your research? So it's not just research for the sake of doing research anymore. And then you must, in the literature review, evaluate the current state of research and demonstrate your knowledge of the current scholarly debates and arguments around your topic of interest. Imagine you aren't well versed on this is something you're interested in, but you're not well versed. You submit something, but and you use some outdated theory that really poorly fits your argument, and the reviewer comes up, tells you, but have you not heard of this theory? It's a widely used theory, it's quite seminal work, why have you not considered that? And then they would have questions around, do you know what you are, do you actually know what you're doing? So just to get back to the point of the relevance of the evidence that you are using. For example, you can't use evidence for an adult population to frame the argument for a pediatric population, unless little to no research exists for the pediatric population, where in that case you need to disclaim this and state that there is an evidence for pediatric, from the pediatric sample or population, and therefore we need to extrapolate from the adult population, but it's within these limitations. So it's not about, with research and with science, you state the limitations outright. So you should never hide these shortfalls or shortcomings. It's about stating these and then finding ways of recommending how to do things better. Another example would be using evidence from, for example, high-income countries as the evidence base for low to middle-income country settings, unless, again, there is little evidence for the latter. So the reason and the justification for reliance on such proxy evidence must be clearly stated. And it is allowed to use such evidence, but it must only be used if you've done very thorough research and you are sure of what you are saying. However, you can't use evidence, for example, for a completely unrelated condition to demonstrate what you're seeing in another condition, right? Like using findings for medication to treat UTI as evidence in the treatment of hypertension. I mean, just to use a silly example. So if there's, for example, no evidence for a certain medication in treating hypertension, where it's maybe a medication that's typically used for something else, that's where there's some speculation that it might have some effect on hypertension, then you can use a proxy condition like stroke, for example, or stroke cerebrovascular accident, to demonstrate the evidence, but as I said, as a proxy for something else. So these are the key 5 steps in the literature review. First, search for relevant literature, evaluate the sources, identify themes, debates, and gaps. So that is how you build the need for your research, the argument for why you're doing what you're doing. Outline the structure of the literature review. So there has to be a logical flow. It can't just be piecemeal and all over the place. Or just one long winding paragraph. It has to be broken down into subsection, and one subsection must speak to the other. So there must be a logical flow, and that's that is just so paramount in research, is having that constant flow and logic throughout from beginning to end. Once you've outlined the structure, is then writing the literature review. So the literature search, this obviously comes before writing the literature review. And there are people that are quite skilled whose jobs it is to just do this. So like librarians, but with experience. I'm not talking about librarians just in a normal sense, but librarians who are well trained and have experience in conducting searches. But if you have to start off with a literature search, and the thing is a good search or a bad search can make or break, you know, your proposal, your plan, you know, the argument that you are basing this. As I said, imagine you are missing out on important evidence. Then there are big gaps in the argument you're trying to lay down or trying to frame. But you start typically by creating a list of keywords that are related to your research question, and you include each of the key concepts or variables of interest, as well as synonyms and related terms. So it's not just about typing in, oh, what happens, da, da, da. There's a very specific skill to running a good search, which is also another topic. But you know, yeah. So if you have in your search, you have all related or as comprehensive a list of keywords and synonyms as possible, it means you are casting that net wide enough so that you are capturing everything possible that you're supposed to capture. But also it can't be too broad either, where you are capturing irrelevant things and you have to wade through a morass of things that have no relevance to what you are looking for. Thirdly, you can also add to this keyword list. So this keyword list is like a work in progress. You are always modifying and refining the list because you discover new keywords in the process of your literature search. So you might not have known of, you know, a certain term, and then you come across it in your search. And usually when you type in search words, in the different databases, it will also throw out, if there's a history, it will throw out, you know, other related search terms. But it's important to have a librarian. I would say have a librarian or consult a librarian at this point. So examples would be, you know, like if you are wanting to look at adolescents, you would use adolescent and the synonyms for adolescent, like youth, juvenile, teenager, teen. There's a lot more, but I'm just, you know, in the interest of time and space, I'm just using a few. And then pregnant synonyms would be maybe gestation or expectant. If you can think of other examples, great. You have to search the relevant sources. So for example, you can't search, I'm going to use very obvious examples now, but you can't use sources that's used in the engineering field or the computer science field when you are looking at a health outcome, for example. But in this field, in the health and the human health field, these are useful databases: EBSCOhost, PubMed, Public Central, JSTOR, Medlines, and Null. There's a few more that I can't think of right now, but it also depends on the databases that your institution or university has access to. But usually the universities have access to the mainstay of the credible source database sources. So in the literature search, and again, I'm brushing over this because there's a lot more that goes into it, but it's just to give you kind of a snapshot, a quick and dirty intro to what goes into the process of starting a research proposal. So in the literature search, the use of Boolean operators. So Boolean operators are words and symbols like and, not, or where you use the and symbol or the slash forward or backslash. So using these symbols or operators alongside keywords is recommended to help narrow down your search. So as I said earlier, your search must be broad enough that it captures all the relevant sources, but it must also be narrow enough that you kind of cut out all the noise. And this is where the Boolean search operators come in. And creating a Boolean string is an effective way of saving time and finding useful sources, and will refine your search to find the most relevant sources and results. Like I did for my literature review, instead of a literature review, I did a systematic review, a scoping review, but I did the scoping review in a systematic way. But involved at the outset, I used a librarian. So the librarian then, so this is for my PhD protocol. The librarian then generated a list of keywords and the search strategy. And this is examples of Boolean operators. So like genetics and cloning, for example, or genetics or cloning, genetics not cloning. So with genetics and cloning, you would capture, for genetics and or genetics or, you would capture all of that. The third one, you can see there, you would, because you're not interested in the cloning part, you would then not capture the literature that focuses on that aspect. So this speaks to the point I made earlier about my own PhD. So researchers and scientists are increasingly using scoping reviews or systematic reviews to summarize the evidence in a systematic way, and also to define the problem rationale for the research. Because there's nothing wrong with doing just, the normal literature search or literature review, but then it has to be done well. But if it's done in a systematic way, that's required from a systematic review or even a scoping review, then it's almost like it's less. There's less. Not less. There's still questions, because if a scoping review or review isn't, the search terms aren't well defined, then it's not a poorly done review. But it's there'll be fewer questions from reviewers if it was a review that was done systematically. Just as a side note. Right, so this is still in the literature review, right? Then, so you've laid the groundwork, you've done the argument for why it is you are wanting to investigate, what you are or what you are proposing to investigate. Then you also need a theoretical framework that will underlie, how you interpret, how you make meaning of what you are seeing. So before starting your research, you must become familiarized with the theories and models that other scientists and researchers have developed. So again, I come back to this point. We can't. You are in a world, you open yourself up to a world of pain if you just jump straight into it. There's a lot of planning that goes into things before you get into the actual doing part. So, and it's quite a bit of a process to, but it's necessary to do all these things beforehand. So, and this is also where, supervisors or people, like the people, not necessarily with research, research knowledge, but the people who have the content knowledge will be able to tell you, listen, this is the most recent, theories, or, look at this theory. I think this is better suited to what you are wanting to answer. So consultation is very important, and working or collaborating with people. Your theoretical approach provides the framework to present and explain your current findings. So as I said, where you make meaning of and draw links between what you found in your study. When you lay down your theoretical framework, you must compare and critically evaluate the approaches that different authors and researchers have taken. So even if this is your theory of choice, you must also provide a critique of that theory and what are the opposing views, or what the theories are out there that says otherwise. So it's about, again, you're interrogating your own argument, essentially. Various theories on the topic most likely exist. Therefore, you will evaluate, compare, and select the most relevant ones. And by framing your research within a clearly defined theoretical approach or field, you make the reader aware of the assumptions that underpin your approach. And you also demonstrate the rationale behind your choices for the methodology and discussion sections. The discussion section isn't applicable in a proposal or protocol, and I'll talk about that later on. The theoretical framework also lays the foundation that will support your analysis, interpret your results, and make broader generalizations from what you found to the broader populations. You can use various theories to explain different components of your topic. If one single theory, for example, doesn't offer a comprehensive understanding of what is found. And sometimes what has happened is as people, you've decided on one theory, and then as you read and you collect information, you might even have to go back and change or adapt or add a different component or add another theory. But it must all speak, and the theory must also be able to answer the research question. It must be able to make sense of or make meaning of what it is you're setting out to do. So it's, remembering that golden thread. And if a theoretical framework, for example, does not exist in a certain field, an argument or approach that's maybe not a theory, that hasn't been laid out as a theory, can also be used, because for something to become a theory, it takes years and years of work and a lot of work, years and years of research and a lot of work goes into it. So that's the theoretical framework part that's essential in a research protocol. For the essential, but as I said, if it doesn't exist, you can use an argument, but you must have something that kind of draws everything together. The methodology, this is the meat and everything, and the bones and the spine and everything of the research proposal, of the research process, the proposal, dissertation, anything. So the methodology it refers to the specific procedures, techniques that are used to identify, select, process, and analyze information about your specific topic of interest. And this section allows the reader to critically assess the study's overall validity and reliability. I'm sure you've come across these terms, but we're not going to go into it. I'll briefly mention it again later on. So this method section, methodology, explains important aspects of the study, including the research design, the data collection methods, the data analysis approach, and the overall framework within which the research is conducted. So choosing an appropriate and sound methodology is important for providing a blueprint for replication of your research. So if another researcher wants to replicate your work, they must be able to use your methodology and follow it step by step and get exactly the same findings that you have. And that is how I've actually come across some news articles where I think it was in the field of chemistry, I can't remember, but where researchers replicated a paper that was published, and they found vastly different results, and eventually it was discovered that the researchers of the original paper actually fudged and made up data. So yeah, that's again, transparency is critical, and doing things a set way and not veering off the plan that you set up. Then secondly, the methods section of the methodology must answer any questions about the research that may arise later. It provides a framework and guidelines for clearly defined research questions, objectives, and hypotheses. So again, you see how this thread pulls through. It's important that it identifies the most appropriate research design, sampling technique, and data collection and analysis methods. It helps researchers ensure their findings are valid, reliable, and free from biases and errors. So there's statistical terms like risk of bias, sampling error that we won't cover here. The methodology, or a good methodology, must ensure that ethical guidelines are followed for all study procedures, and that it's also important for planning your research and ensuring efficiency through optimal usage of time and resources. Right, so very briefly, I'm going to try and zip through this. We have three main types of research methodologies. There's the quantitative approach. Here, in the quantitative approach, we measure and test numerical data. We typically have a large number of participants, which allows for broader coverage of a topic. And in quantitative, we typically test causal relationships, we make predictions and generalizations to wider populations. Qualitative methodologies, these we use to examine opinions, behaviors, and experiences. Here we have fewer participants, but it allows for the research to go deep, so a deeper exploration of a topic. So where quantitative goes wide, qualitative goes deep. This is typically exploratory research where the research problem or the research question is not as clearly defined. Then, as I mentioned earlier, researchers are, many researchers are using the mixed method approach now. So this is using both quantitative and qualitative methodologies in the same study. So this is typically used to validate findings and verify the results from both, and to verify that the results from both methods are complementary. So findings from the qualitative and quantitative components must speak to each other. And we also use with this methodological approach, use this to explain unexplained results obtained from one method by using the other method. So for example, if there is something that came up from the qualitative component, which would be the smaller component, we would then maybe, if something comes up that is flag of interest that we didn't anticipate before, we would then not explore that, but would try and answer that with more confirmatory approach with the quantitative part. And it's also, this mixed method approach is also used to, again, as I said earlier, before we get into the bigger quantitative study where we invest a lot of resources, there's the smaller component that lays the groundwork for. Before we go into the bigger part of things, let's look at what emerges as key concepts or phenomena of interest to investigate further in the quantitative part. Right, so what are the key elements of the research methodology? And this is what in the protocol your method section would include, almost like not almost like, it is the subsections of the research methodology. Firstly, you have to have the research design section in there. So in the research design section, there you explain the research design, And this is usually selected, not usually, it must be selected based on the research question and the data that you require. So for example, if you are your outcome data, or what you are wanting to change or see change in is quantitative or numerical, or something that has to be measured, you would then use a quantitative design. So common designs are descriptive, exploratory, experimental, quasi-experimental, correlational, cross-sectional, longitudinal, or cohort. And unfortunately, I don't have time to go into a description of each of these. But it's just different approaches. So for example, in an experimental, you'll have an experiment that the researcher directly manipulates. So for example, administering different levels or different dosage of a medication, whereas in a quasi-experimental, it's still an experimental, but there isn't direct manipulation of the researcher doesn't directly manipulate the experiment. Correlational is looking at whether there's a positive or negative relationship between variables. Cross-sectional would be a study design that is done at one point in time. Longitudinal is over a longer period of time. Cohort would be following the same cohort of participants over different time points, and so on. The second element is the research method or the research approach. So there it would be either quantitative, qualitative, or mixed method. And here you also need to explain why a specific methodology is most appropriate for answering the research question. Then you need to describe the setting and the participants. So you explain the setting and the context within which the study is conducted. So especially in South Africa, we go to great lengths of explaining, if we did research at a specific hospital, but we will explain the socioeconomic conditions of the surrounding area. We'll explain the metropole. And I've seen through, in our journal clubs, we critically review papers, the papers from the US and the UK. It's like you need to just know what their countries or their areas look like, or how their communities are defined. Some studies are making an effort, but typically it's usually South African studies that do a proper explanation of the settings, versus the United States studies. They would just say a study was conducted in Denver, Colorado, and nothing more. And then in this section, you also describe the study population, who the participants are. So male, female, age, sex. Race has become a bit of it's a sticky one, because the review ethical committee will ask, if you want to include race, it's all good and fine, but there has to be a reason. You cannot just include race for the sake of including race. It used to be that that wasn't really something that flagged anything before. I think it was in sports science, the division of sports science at Stellenbosch University, that found something about colored women. I cannot remember, but it was some negative something around colored women. And everyone was, how did it pass even how did it pass ethics through the ethics committee? Because the findings were so controversial, what they were saying. So after that, ethics review committees have more and more, sat up and paid attention to this. So they will ask, why are you, or at least the committee members who are more clued up will ask, why are you, are you looking at race for a specific reason? You know, because you have to be careful about the conclusions you draw at the end of it. Then there's the sampling and recruitment section or subsection. Here you talk about selecting a representative subset of the population being studied, including the sampling method, so whether you use randomized sampling or non-randomized convenience sampling or probability sampling. So as you know, with randomization, participants have an equal chance of being assigned to either the group that receives the intervention or the group that receives the placebo, for example. And non-randomized is that, you know, there's different forms of non-randomized sampling, so convenience sampling, probability sampling, where there's no form of randomization. You just recruit or enroll participants that meet, you know, the criteria. You also in the section have to explain the recruitment methods used. So did you use hospital records to identify potentially eligible participants, registries, newspaper ads, flyers? So that speaks to the recruitment. Oh, what I didn't put in there with under sampling, another example would also be, for example, like snowballing. We're using snowballing techniques. That's usually used in convenience sampling, but again, that's another topic because all of these are technical terms that takes a lot more, you know, as I said at the beginning, I'm trying to compress a lot of concepts in a short amount of time, but I'm more than happy to do follow-up sessions. For the research instrument section, they explain the instruments that will be used, such as interviews, surveys, assessments, biomarker tests, anything you are going to use to test or measure your outcome of interest. And you would also provide reasons for choosing certain instruments. I'm going to use my research now. For example, I am looking at neurocognitive functioning, and I'm linking that to brain outcomes or morphological changes in adolescent brains. And I'm using certain test batteries, cognition test batteries. So I'm looking at test batteries that measure executive functioning, for example, and that speaks directly to the brain morphological or the brain morphology that I am hypothesizing will be influenced by binge drinking. As an example. So like within the cognitive testing that I'm using the NIH, for example, National Institute of Health Toolbox. It's been widely used. So this is the section where you would explain why you are using what you are using. You talk about, you you provide the reader or the reviewer with why what you are using is sound, it's credible. You know, you can't use let me just think of a better example. If it's something that I just, I scribbled a few questions and I'm using that to measure a certain outcome, there'll be a lot more questions if I'm using something like that compared to a test that has gone through rigorous validity and reliability testing. So it has psychometric properties, so you can trust the results or the findings that you're going to get from these instruments. You can trust that what you are seeing is an accurate reflection. And I'll briefly just mention what I mean by reliability and validity. I'm sure these aren't these are concepts that are known to you. Then the data collection section, there you report on data collection procedures, how the data will be collected, the methods. So that's like the nuts and bolts, the procedural part. And it really has to be you know, you have to spend a lot of time explaining each and every step, you know, what you do at each step, you know, who is involved in terms of research team at each of these procedural steps. In the data analysis section here, you describe the data analysis method. So these include the statistical approaches that will be used, also the statistical software. So I'm a quantitative person, so my strength is statistics. But it could be with qualitative, it could be maybe like what thematic analysis, content analysis. I think those are some of the data analytical approaches that can be used. But with the statistical analysis, there's a wide variety of methods that can be used. So you do regression analysis, modeling, survival analysis. But again, it needs to, it's not just doing statistics because it sounds sexy. It has to be appropriate to answer the research questions, the hypothesis, aims, objective aims, and the research question. I remember as biostatistician who I trained under said, sometimes the simplest statistics are enough to answer research question. You know, we want to do all, you know, like the modeling, the sophisticated stuff, but sometimes it's just not necessary. So you have to be careful when you choose an approach. So this is the reliability. Oh, it's late. Validity and reliability I referred to earlier. So validity refers to the accuracy and the truthfulness of study findings. So in other words, does the study measure what it is supposed to measure? Reliability refers to the consistency and stability of results over time and across conditions. And together, these two concepts indicate or speak to the trustworthiness and accuracy of study findings. So tools, instruments, scales, to ensure validity and reliability, we use tools, instruments, and scales that have been widely used in the scientific literature, that have established psychometric properties, so they have established validity and reliability indicators. Cultural relevance is also an important aspect. I'm sure you have come across this. If a scale was developed in a different context, like the US, where they mostly are, if we apply it in a context such as ours, where, you know, we use different language, we use different terms, we're not going to get the same, we're not going to get findings that's a true reflection of what we are trying to see. Like with, again, I'm going to use my study as an example. I'm using with the cognition, and this is a major limitation. The cognition toolbox I'm using, it uses, even though it's trying to be culturally relevant, but it's clearly, it's American, the examples it uses, the way, because the tests are done through an iPad, the way the voice sounds, it's American, the pronunciation. So all of these will have an impact on my findings, because I can see that many of my, especially Afrikaans speaking participants, are sometimes struggling, and I would need to often interpret for them, or, you know, explain in Afrikaans what this voice is saying, which actually interferes with the standardization, because standardization is also important in when it comes to the procedural part. You have to be standard in how tests and scales are administered, and that is a limitation in my study, which I will discuss in the limitation section of my thesis. Then for the data management part, this refers to the handling, organization, documentation, storage, and the preservation of data, both during and after research. So broadly speaking, it refers to good data governance. So when the data is collected, how is it stored? You know, things like using password protection, you know, password encrypted files. How will electronic files be stored? How will it be shared? Not using email to share confidential patient information. And also after completion of research, because as you know, for those who've done GCP, data has to be archived for a 5-year period or 4-year period. And it needs to adhere to certain GCP good clinical practice guidelines. So good management or data management ensures that researchers are able to share data in a findable, accessible, interoperable, and reusable way, which we refer to as fair way. So interoperability is the ability to exchange and make use of data and information between different systems and different studies in a safe way. Where in a way where we won't, for example, lose data or corrupt data or expose confidential data. The POPI Act has in recent years been a cornerstone in how we speak about data protection and data management. So protection of data, of personal information, privacy are key cornerstones of data management system, and it must adhere to all POPI regulations. Then there's the research limitations component. I've just used my study as an example, but here at the proposal part already, right? So even before you've conducted your research, you would already report in the proposal, the protocol stage, you would report foreseeable limitations while you are conducting your research. And you usually get a sense of potential limitations by you know, through your literature review, through, you know, what others researchers that have done similar studies, or maybe like similar studies but in different settings, but limitations that are obviously relevant to yours. You can use these as potential limitations. So as I stated earlier, it's about transparency and not sugarcoating anything. Then ethical considerations. This section is very important. So as you know, all research must be conducted ethically. So in this section, you would include discussion around informed consent, beneficence and maleficence. So that's the beneficence, maximizing benefits, maleficence, minimizing risks, protection of participants' rights, privacy, confidentiality, and you know, with informed consent. I'm not going to spend a lot of time because I'm sure you are well aware of this, but informed consent is very different for adults compared to minors. So with adults, it's informed consent. We obtain consent, whereas with minors, we obtain assent, and we can only obtain assent from minors after we've received consent from the parents or legal guardian. Depending on the research, especially with drug trials, it has to be a legally court-appointed guardian. It can't just be an aunt, but the reality is many of our children live with granny or whoever who aren't court-appointed. But then I think in those cases, GCP requires that there's some sort of affidavit, but they are very strict in the informed consent and obtaining informed consent. So that's as you can see, as I said earlier, the methodology is the core part of the meat and the bones of the research proposal. And you know, anyone who wants to maybe do something similar. Your methodology should almost be like a standalone. It must be able to stand by itself, and just from reading that, I must be able to do and replicate each and every step that was done by the original researcher. That is why explaining every step, all procedures are important in that protocol proposal stage. Then these are final sections. This is after the method section. So there's usually the declaration of conflict of interest before the ethics committees didn't really bother about this, but now it has to be in. It's also with writing scientific papers for peer review. There must be a declaration of conflict of interest. So with this declaration, or with conflict of interest, this identifies and manages conflicts of interest, and it promotes good governance and objectivity in research. So typically we have financial or tangible conflicts, such as sources of funding or grants for research, receiving consultation fee from a drug manufacturing company for drugs or equipment used in the research you're conducting, for example. So this is where if I am doing research on alcohol abuse or some sort of drug therapy to treat something, and my research is being funded by the liquor industry, that would have to be, I mean, it would be problematic. I don't even know if it could pass muster, but I would have to state that right at the at the outset, at the proposal stage. Or if I'm, as the researcher, as I said here in this example, receiving consultation fee from some company, that develops the equipment or the drugs that we are testing, then that conflict of interest must be declared, because it introduces a measure of potential bias, where a reviewer will ask, but are the findings, are these objective, credible findings, or is it because this is what you want to find because you have some interest in this? Then there are also the non-financial or intangible conflicts of interest. These include personal relationships, professional affiliations. For example, if an author or a researcher has a relationship with a member of the company funding the research. Acknowledgement section, that has become very, very important over the past few years. In this section, the researcher thanks all the people who assisted in the proposal, or the research process, or the thesis, or whatever it is, whatever the project is. So whether the person assisted with some part of the writing or editing, or any person who aren't who's not a supervisor or co-supervisor, but who supported or provided some form of support, that person is mentioned in the acknowledgement section. It's very, very important to name the institution or institutions and the funders who supported the research. So usually the institutions provide financial support. Obviously, the funders provide the grants, but institutions provide resources like office space, using the copy machine, all of that. All of those are resources that helps in making the work possible. And not acknowledging institutions and funders have become a serious matter over the years, or it's seen as a very serious matter, because failure to acknowledge or to acknowledge accurately may impact future funding opportunities for the researcher. Because if the fund or the institution says that we're not even acknowledged, they will think twice about supporting that researcher. So it's not just in the proposal, it's with the reports at the end. So the reports scientific review, conference papers, conference presentations, anything that emanates from this work. Those funders, institutions, everyone needs to be acknowledged. Then is the reference list. I know this seems, obvious, but I thought let me include every part or aspect that gets included in the proposal. So with the reference list, it's important that you check the preferred reference style of the HREC you are submitting to, or if you are writing a research paper for a journal article, usually different journal articles have different referencing styles that they require. So be Vancouver, Harvard, or APA style. And it's important to use a reference management system to manage your library, because all of us were using, you have electronic libraries these days, and it's we use it to easily switch between different referencing styles. So examples of management systems, and I should have said this earlier, because it's a good idea to, even at the beginning when you start off with writing the introduction, start with, because remember you're going to have citations in the in the literature review. Start with using a reference management system right at the get-go, because if you are, for example, submitting different components, or you're writing different papers emanating from your research, but you submit it to different journals. Each journal has a different referencing style requirement, and using a reference management system allows you to easily switch between Vancouver style, Harvard style, APA. So it's just you click your preferences, and then it will change the in-text citation style and the references at the end of the list. It's very difficult if you've already done the research proposal, or you've already done the scientific report, and then at the end you want to go back and use a referencing management style. Then it becomes very tedious, because you kind of have to go back and start from scratch. The examples are of reference management styles are EndNote, RefMan. I can't remember the other one now, but there are quite a few. Then the appendices that come at the very end of the report. So in this case, the proposal or the protocol. And the appendices contain all the additional information and materials that provide a more comprehensive understanding of what you are researching. So for example, if you have SOPs, your data collection tools, you would attach as to a protocol, you would attach as an appendix, your informed consent forms. Even if you have, if you recruited using flyers, you would attach that as all of your as the appendices, because the reviewers, I don't know how much they actually look at that, if they go through it in detail, but they will check to see whether, do you actually have the informed consent? And if you are working with minors, do you have the assent? And does it cover what it's supposed to cover, in terms of ethical considerations? Yeah, so that is the appendices. So just as a few final points, the research proposal is always written in the future tense, because the proposal is the plan for what will still be done. I should have had this in this slide, but your proposal, your protocol always starts off. So before the introduction, you have an abstract, and the abstract is a summary that summarizes everything briefly about the background, introduction to the study. Briefly speaks about the methodology, You obviously wouldn't have conclusions at this point, but you would then have a list of keywords as well. And a good abstract shouldn't be longer than 500 because it has to be concise. But that is almost like an executive summary. The reader should have a pretty solid idea of what it is you are investigating and how you are investigating it. So as I said earlier, right at the beginning, there's certain sections you will not obviously have at this point, and limitations should actually come out here. I do apologize. You will not have the results section. Obviously, you won't have discussion. You won't have future research and recommendations, and you won't have a conclusion. You could have a conclusion in terms of just, saying what the proposal is going to do, but you won't have a conclusion in terms of drawing your findings together. So, from the results to the discussion and what the key take-home messages are from the research. Sorry, conclusion in that sense won't be in a proposal. Oh, I do actually have it in here. This is where I talk about it. So user reference management program, yeah, RefMan, EndNote, Mendeley, Zotero, these are good management systems to use, and use this right at the beginning for both in-text citation and the reference list at the end. So before I get into the practical session, is there anything I need to clarify or maybe just recap quickly? Sure, I see it's almost 8. I didn't realize I've been talking so much.
No, I think we're all good.
Okay.
Yeah.
I'll just quickly, I'll go through this part very quickly because I'm sure people are quite exhausted by this point. Okay, so for the first part, I thought we'll look at examples of good versus bad research questions. The lady who did that first exercise earlier, I think she will find this part easy. So remember, we always use the PICO model: patient, population, intervention, or exposure, comparison, outcome. The first question, do women who take medication have better outcomes? The second question, so I want you to tell me which of these are the good question, which is the bad question. First one is, do women who take medication have better outcomes? Second one is the ACE, again, the same example of earlier, is the ACE inhibitor enalapril more effective in preventing adverse pregnancy outcomes in pregnant women with mild chronic hypertension compared to those not receiving any treatment? Which of these would you say is a well-defined research question?
I can give it a try.
Yeah.
I think the second one is ACE inhibitor enalapril more effective in preventing adverse pregnancy outcome in pregnant women with mild chronic hypertension compared to those not receiving any treatment.
You are right. Why do you think it is a better question or a well-defined question compared to the first one?
So it has the population. I forgot I know there's a PIC. I forgot what they mean, but
PICO.
it has a population.
PICO.
Yes. PICO. So it has a population. There's a C, it stands for control, has the control as those that do not receive the treatment, has an outcome of whether or not it's is effective in preventing adverse pregnancy outcome. And then the I forgot what the I means.
The intervention.
Yes, the intervention is the ACE inhibitor.
Yay. Well done. Yes. So that first question is very vague. We don't know what the treatment is. We don't know what the outcomes are. And I won't repeat because I have exactly the same reasons listed as you had now. But thank you. That really, that's exactly what I had in my answer to this one. Then if we use that same question, the second question is ACE inhibitor, that one, to identify, well, you've done it actually already, so I'm not going to ask that part, but what is the independent variable and what is the dependent variable in that case, in that research question? What will we, let's start with the independent variable. So the factors that are having or exerting an influence on our outcome of interest.
I can guess.
Mm-hmm.
The independent variable is the mild chronic hypertension.
Mm-hmm.
And the dependent variable will be the ACE inhibitor. Whether or not they're taking the ACE inhibitor, do they have the desired outcome or the predicted outcome?
You are right on the first part, with the independent variable being the mild chronic hypertension, because that's the condition that the researcher will directly manipulate. The dependent variable, however, is always the outcome of interest, which are, as the PICO indicates, the outcome. So the adverse pregnancy outcomes. It doesn't state what those adverse pregnancy outcomes are because there's many different adverse outcomes, but it could be stillbirth or abortion, spontaneous abortion, preeclampsia, but those would be the dependent variable because we want to see that's what the research is interested in measuring or seeing a change in. And would you say what is the relationship or the hypothesized direction between these variables? Is it a positive or negative one between the medication and the pregnancy outcomes? So remember, the positive relationship would be both of them. As one increases, the other increases. An inverse relationship or negative relationship is as one increases, the other one decreases.
I think it will be a negative.
Yes, absolutely.
The more they take the enalapril, the less adverse events you hope they would have.
Perfect. Yes, absolutely. So yeah, because sometimes people get, when we refer to positive relationship, they get confused and think it's a good relationship, but that's not what that refers to. It refers to the directionality of the direction between, or of the relationship between the variables. I'm going to skip over this because this might take too long given the time. I thought we could write, we each of us write one or two well-defined research questions, but I think we've really unpacked that and we've gone through a few exercises. If we use this, and please tell me if we should rather stop now or if we can go for another minute.
How long is the presentation further? Is it how
no
long?
there was the navigating the HREC process, but I think that we can keep for another time. It's yes. Too much to yeah. Okay,
so we can I think we can finish the practical sessions and then
this is we'll just finish the spot then. So then if we do the aim from the same research question, the aim, objectives, and the hypotheses. From that question, the aim, so let's just go back to the question again. Right? Is the ACE inhibitor more effective in reducing adverse pregnancy outcomes in women with mild chronic hypertension compared to those not receiving any treatment. So the aim, the way we would formulate that aim would be, this research seeks to establish whether the ACE inhibitor enalapril reduces adverse pregnancy outcomes in women with mild chronic hypertension compared to those who are not receiving treatment. And you can see it almost sounds repetitive, but it has to speak to the research question, but it's almost, it just makes each step makes it more actionable, as I pointed out earlier. The objectives then would be, and here we would have more than one objective. The first one would be to assess if enalapril is effective in reducing the number of stillbirths in women. So these are the adverse. So yeah, we're making it more actionable. The aim is, as we said earlier, low resolution, less specific. Yeah, we're becoming more specific because we need to be specific about what's been measured. So what do we mean by adverse pregnancy outcomes? In the case of this research, for example, adverse pregnancy outcomes were stillbirths and small for age SGA neonates. So the first objective was to assess if this enalapril is effective in reducing the number of stillbirths in women with mild chronic hypertension compared to women who do not receive any treatment. Second objective is to determine the effectiveness of enalapril in reducing the number of SGA neonates in women with mild chronic hypertension in comparison to women receiving no treatment. Then the hypotheses, remember, with the statistical testing, we have to state the null. So the null would state that no difference. So each hypothesis speaks to a objective. So the null states that there's no difference. So whether they receive the treatment or not, there won't be a difference in the number of stillbirths. That's what the null states. The alternative hypothesis, which is the hypothesis we are trying to test or trying to establish, states that women receiving enalapril for the treatment of mild chronic hypertension will experience a lower number of stillbirths compared to women who receive no treatment. And then, as you can see, the second hypothesis will then speak to the null, and the alternative will speak to the second objective. So there's a very clear, it's a clear, logical, linear thread throughout. And that research question, aim, objective, hypothesis, that is what pulls everything together in research. And so whether you are writing a protocol, whether it's, as I said earlier, a research scientific report, this is the groundwork, the foundation that you have to use. So yeah, it's a lot, it's information overload, a lot that I try to squeeze in. But I think as we go along, and if people are open to a series of these sessions, we can start with a more, the practice, the practical path in, using this and these concepts and this theory, and actually applying it and working on what a good protocol looks like. And then also, as I said, how to navigate the whole HREC process, which is a whole nother story. Yes, so I'm going to just go over, this is for another time. Oh, just one last thing. The research team is very important, how the research team is constituted. So an ethics committee, for example, want to see that the members included in the research team, they each have skill sets that are necessary for conducting the research. So, for example, like the PI would maybe have content knowledge, and you would normally have more than one PI. One PI would have content knowledge, another PI would be the research part, would be a research expert. So that's usually at the top level. It's important that you consult a methodologist or statistician before embarking on a research proposal, so that you make sure that that golden thread is clearly defined. I'm not going to go through that. And this is how our research team typically looks. So the PIs, it's normally more than one PI. We also have advisory committees. So a trial steering committee. The trial steering committee provides the independent oversight of the trial. Is it being done, scientifically? Are you following procedural steps? Sometimes studies also have a community advisory committee that these are usually the gatekeepers. They facilitate community support. They identify key priority areas. Then there's the trial manager. We tend to, they might not always form part of the research team, but we always consult a methodologist to make sure that we're using the correct statistical approach. If we are testing an intervention, there would be the interventionist. At each level, these people are trained at each level. So the interventionist is trained to deliver the intervention. The field staff, those are the people that do the collecting of the data. So they administer the scales and the tools. And SOPs, field training manuals, these are all important in the research process. And as I said, the ethics committee, they are very strict on that. That's why you have to submit CVs. When you submit the protocol, you have to submit the CVs of each member of the research team, so that the review committee can see that they do have the skills required. So this is the part I said that we're going to leave for another talk.